All right, Norma. So we are about 24 hours after your surgery yesterday, and actually we did two treatments. We did and what we call an apical surgery on two teeth, but also we did a crown lengthening on the other side of one of the two teeth. And we're about 24 hours later. I, as your doctor, even though I've seen this repeatedly, I am still amazed of how healing is going. But I want patients to actually hear from another patient, but also more importantly, I want their doctors to realize there's more to give to the patient, and patients should expect better care. So talk to us. Tell us your story, your past, your what happened, how scared you were maybe, and then how you feel now 24 hours later. Anything you want to say, it's all yours.
Right, yeah. For my experience was before the treatment. 1 hour before, I was really scared, and after the surgery, it was like I went home with a little bit swallowed. I put this ice pack for like 10 to 15 minutes, and then I took just ibuprofen, the 200 milligrams, and then I was really scared because I got stitches, and I got the laser, and but just with the 2 milligrams, 200 milligrams works for 2 or 3 hours. Um, but then it gets a little bit like not really like killing pain, just like something start coming up, the pain, a little bit pain, and then I took another Tylenol extra strong. Since probably after the my pressure was 12 o'clock, so between 7 hours I took just 2 times medicine. So and then 10 hours later I didn't take any medicine, like no medicine pain. Um, and I can talk normal, I can drink normal. Well, I just taking care of myself, not eating like spices and just eating soup and protein drinks. But I remember one time I took the Wilson tube, and it was really worse. I had a swallow for 3 days, and I don't remember how much medicine take, like regular, like counter medicine. But I was really worse pain, so I called my dentist, and I told him that I had so much pain, so he gave me antibiotic, and he gave me like one narcotic. But for my experience, I don't like narcotics because it was really worse experience. I feel dizzy, nauseous, and I was not myself. So, but now with the laser, it was like I was really scared because I got the stitches, and it was like, oh my gosh, it's going to be again. Maybe I had to take narcotics, and I was like, I don't want to take narcotics. Um, but I didn't get anything. I didn't took anything, and yeah, I had just a little bit swallowed. And um, yesterday I was when I took my Winston's thing, I cannot talk because I was like, if I move my jaw, I feel pain. But right now I can talk, and I'm gonna go to work right now, and I feel okay. Yeah. So I really thankful because this pressure worked really well for me.
All right. So maybe the only bad thing is you have to go to work, right?
Yeah, because I was spending. Maybe I can stay home, but right now I'm okay. Yeah.
So just to be clear, from the time of treatment yesterday to now, you took one time 200 milligrams of ibuprofen, right?
Ibuprofen.
And then two pills of Tylenol, extra strength. That's
Extra
pretty
strength.
much it.
Yeah.
No, nothing else. Nothing else in terms of the narcotics you were prescribed. You never filled a prescription or anything like that.
No, I never feel it because I was thinking if I got worse, I will prescription. But yeah, I didn't have to take it.
Okay.
Yeah, so we can say between 12 o'clock to right now it's 7 a.m. It's 8 a.m.
Uh huh.
So I took just 3 3 pills of
3 pills. That's crazy, isn't it?
yeah, it's
Oh.
3 pills of medicine. Ibuprofen and Tylenol.
Okay.
And that's it.
And we did 2 treatments. It's not even one. You know, we did 2 teeth and then 2 treatments.
Yeah.
Crazy.
Yeah. Because I can feel in the exposed skin.
Yes. And still no
that's
pain.
it.
And
No pain. Actually, I drank my coffee this morning and I was kind of scared. Oh, I hope it didn't hurt, but.
That's right.
And that was like a normal, just, yeah.
And in terms of pain level, so I know you and I discussed this, but I want people to hear it from you. You know, if 10 out of 10 was the worst pain you've ever had, what was the worst pain since yesterday to today?
Yeah. So my treatment was 12 o'clock.
Uh-huh.
So the worst pain came probably 3 hours later.
Okay.
And that was probably between 6 and 7.
Mm-hmm.
That was the worst. I
Okay.
think that was the worst because after the anesthetic goes, but it was like this pain, like you feel like something is spooky, like no, something is going to kill you. Yeah,
Okay.
Yeah. I feel more pain when I was the wisdom. Yeah.
Wisdom tooth extraction.
Yeah. It was worse, but this one, yeah. After they took the ibuprofen, I was okay. Just with the 200, but I think it was a little bit no medicine much today. And then I took when I took the 2 Tylenol, it was just for prevent.
I see. Before you went to bed,
exactly.
Right? Okay.
Yeah.
Okay.
But I think the worst pain, it was like between 6 and 7.
I see. 6 and 7 o'clock, or 6 and 7 in terms of level of pain.
Level.
I see. 6 or 7 out of 10.
Yes.
Right? Okay.
Yes.
Okay.
Never. It was not something like, because yesterday when I left, I went to a meeting. And probably I went to a meeting with my ice bag. It was kind of embarrassing, but probably I get pain because I was kind of talking.
Yes.
And I didn't rest like I had to be, you know. But yeah, I was like I went to a meeting, and then I was in the meeting for 2 or 3 hours, and then I went home. And I took the Tylenol.
I see.
Yeah.
Okay.
But it was like I do my normal life yesterday. I drive.
That's the beauty of all of this. Now the 6 or 7 out of 10, that was before you took the pain medication, or that was after you took the pain medication?
The 6 and 7 are level.
Yes.
It was before the medication.
Before the medication.
Yeah.
Okay.
Yeah.
And then what did you take again, and how did the pain evolve after that? Was it when you took the Tylenol? After that?
No. It was like I took when I took the 2 Tylenol, I didn't have like maybe 4 or 5.
I see.
Yeah.
I see.
Yeah.
Okay.
Yeah.
So the worst was 6 to 7 out of 10.
Yeah.
And then after you took the Tylenol, it went down to 4, and then you went to bed.
Yeah. And didn't wake up for anything. I didn't wake up for anything. I thought that I would have to, but I didn't wake up for anything. Yeah, I didn't wake up. So I took at 7 o'clock the Tylenol. And right now it's 9 o'clock, and I didn't take anything.
I see. And you took the Tylenol 7 o'clock yesterday night, right? This morning you didn't take anything.
No,
After you woke up this morning, you came to the appointment.
Yes,
here,
I came to my appointment.
and here we are talking, right?
Yeah, and right now I don't have anything. Just like I feel
like
a little bit swallow.
1 out of 10, you think? 1 out of 10?
We can say
2,
1.
1? Okay.
But not really. No, like I feel like normal.
See, this is where it will give people an idea of truly how the pain evolves after treatment like this.
Even like when I got root canal. The next day I can feel it like a little bit swollen. I cannot chew anything.
Right.
But right now,
Beautiful.
Yeah.
Thank you for sharing your story here, and you know, and so from now on, moving forward, you wouldn't be scared of this kind of treatment anymore, right?
If I have the opportunity to do the laser trimming, I will take.
Okay.
So it's my recommendation. I'm really happy how far it goes.
Uh-huh.
And yeah, especially, yeah, it was. If I had the opportunity, I will take it the next time. Yeah, definitely.
But remember, it's not about the laser, it's about me, right?
That's true.
I'm just
Your
kidding.
hands are magic.
I'm just kidding. It's a combination with doctor and the
Yeah,
equipment,
the
you know, and
experience,
of
yeah.
course. And
Yeah.
hopefully you won't need this treatment anymore because in a month
Probably.
when we see you again for follow up, hopefully we'll start seeing healing, and then that means we will have saved these teeth from extraction, right?
Yeah.
Awesome.
Thank you so much. Appreciate it.
Oh, you're very, very welcome. Thank you again for taking the time to help us with this. All right. Take care.